Let's hope. All right. Hi, I'm Dr. Elizabeth Murdy, one of the pediatric emergency medicine doctors at the Golisano Children's Hospital. Joining me today is Dr. Mike Scharf, chair of pediatric and adolescent psychiatry. So we're going to be doing a series of these Zoom videos to get good information out to families. And you'll notice it looks a little bit different. I'm going to start with the date. Today is Tuesday, March 24th. And that's because I want to make sure you know information is current as of today, because things are changing very quickly in our world. And then you'll notice too, I am clearly not in the hospital, and that's because I don't have clinical responsibilities today. So I am staying back and socially isolating myself, because that's what we all need to do right now to flatten the curve. So what we want to talk about, it is Poison Prevention Month, and poison centers have let us know that they've started to see a dramatic increase in accidental ingestions of hand sanitizer and other cleaning materials in kids under 6. And what I've invited Dr. Scharf to talk to us about today is that unfortunately we've started to see an increase in intentional overdoses as well. So we want to talk about some safety tips and the scope of the problem and what you can do if you or someone in your family needs some help. Thank you, Dr. Scharf, for joining us.
Well, thank you for organizing this, and I'm glad to have this opportunity to reach out and talk to people. It is a challenging time. We're all making adjustments, and some of the things we need to do may be intuitive, and some things less so. As you mentioned, this is Poisoning Awareness Month, and we're trying to help keep everyone safer. And it's not only about accidental ingestions and poisonings, though. Unfortunately, as you mentioned, we've been seeing an increase in intentional ingestions of prescription and non-prescription medications. So I have seen that clinically in the Children's Hospital, kids who are admitted medically because of these ingestions. Again, we're seeing an increase. I'm also in touch with colleagues at other children's hospitals who have seen some similar increase as well. So what's that about, and what can you do? Well, unfortunately, even before this crisis happened, we've been seeing rising rates of suicidality and suicide attempts, particularly in teenagers, but not just teenagers, actually, in the 10 to 14-year-old age group as well. And so that was already happening. And now we're at a time where everyone is under increased stress.
Mhm.
And while what is bothering any individual child or adult might be different, I think it's fair to say that everyone is experiencing increased stress. And so for everyone, it's worth a little more attention if you're the adult in the home trying to keep the environment safe. And in particular, if there's anyone in your household, really of any age, who has a history of depression, of impulsivity, so that when they get upset or angry, they might do something which they regret immediately after, but they still did it. Or people who have actually had suicidal ideations or past suicide attempts. For those folks and those families, it becomes even more of a priority to make sure that you're attending to the environment, to make sure it's safe and secure while our family members are all home for more time.
Mhm.
And so in this case, oh, go ahead.
I was just gonna say, so some action steps would be
Yeah.
we have medication lock boxes that people can purchase to have. We always want to make sure that we know exactly what medicines are in our house, so gathering them to one central location, and not only know what's there, but really how much of each, in case something does happen. That way we can have a better handle on exactly how much was ingested as well.
Right. So yeah, saying the same thing another way, a survey of your environment. And again, in the broad context, it's not just medications. So that's what I want to really make a push for today. So that would be non-prescription medications, ibuprofen, Tylenol, but also any prescriptions, knowing where they are, knowing how much is there. And again, chemicals that could be poison, same thing, alcohol in your house, knowing where it is, how much is there, and then ideally, if it's feasible, to lock it up.
Mhm.
And we just heard about lock boxes that can be obtained. But at minimum, the survey, the knowing where things are, having them in a location, and then taking every step you can to secure it.
And then also, if you do find yourself needing help or a family member needing help, we have kind of a variety of resources, from the critical urgent needs, such as 911.
Yep.
We have something called mobile crisis. Maybe you can speak to that. But then your
Yeah.
team is really coming online with a lot of telemedicine offerings as well.
We are. So our services are evolving to meet the current demand and the current reality of our, what we have to respond to with this crisis. Our our general services, our outpatient clinic where you would come in for an appointment, we're converting to telehealth and telepsychiatry visits to the extent we can. But there are still therapists on site if you need an on-site assessment or treatment. If you are, or a family member, a child in particular, have a current counselor or therapist, even if it's a school counselor while school's closed, the first thing you do if you have mental health concerns is reach out to your current therapist or provider. Even if they're not available themselves, they should have a message of who's covering and what to do for emergency. If you're not connected with anyone already, you can contact your primary care provider, and there's supports in place to help them be effective resources. And if it's an emergency, if it's an urgent issue, you can always call 911, as Dr. Murray just mentioned. There's also something now called the Behavioral Health Crisis Line, and that number is 275-8686, and that's area code 585-275-8686. And that's staffed with a mental health clinician who can help walk through and figure out how to address an acute mental health concern and help you decide whether it's the kind of thing that you need to go somewhere for an urgent evaluation, whether we could do something with a mobile crisis team where someone could come see you, or even do it through telehealth options.
Okay, so we were almost joined there for a second by my 3-year-old, because again, things are changing. Not to try to bring levity to this, because this is obviously very important, but again, some really great information. So 911 does exist. Those resources that you mentioned still do exist. And then we're going to be taking steps in our own house to try to make things as safe as possible as we can for our kids, because we love them. And we know that everything's a little bit stressful right now. Dr. Scharf, thank you so much for joining me.
Absolutely. Thank you.